Hey, everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we have a new provider, maybe a new specialty, even. There's a lot going on. And this week we have a really awesome special guest. I want to introduce you to Dr. Hayes Estes, owner of Premier Physical Therapy and Sports Performance in Clearwater and Palm Harbor, Florida.
That
Dr.
is correct.
Hayes, welcome.
Thank you so much. Happy to be here. Pleasure to be here. So yeah, Clearwater and Palm Harbor. We have Clearwater is our main office, and we have a satellite office inside of a strength and conditioning gym in Palm Harbor. We've had that location for almost 3 years now. So
Wow, that's
yeah.
awesome. Sunny Florida, better than very cold and freezing, snowing Pennsylvania right now. I'm very
I
jealous.
mean, we are the meme, or the cartoons that you see. It's all over the place down here in Florida, where all the Northerners down here are wearing like T-shirts and bathing suits, and all the natives down here, they got on their fur coats because it's like 58 degrees outside, and they're like, I don't know what's happening. Yeah, it hasn't been this cold in a decade.
Well, yeah,
Yeah,
you don't want to be down here where it's 25. Not
yeah,
fun.
correct.
Not
This is perfect. This is perfect.
That's amazing. Well, I'd love to hear from you. Kind of how I like to start this out is I think everyone really appreciates the origin story. I really like hearing about how you got here. Like what decided you to embark on this journey of opening your own practice, getting into PT? Tell us the goods.
Yeah, I'm happy to do it. So and especially you come in, we're a smaller private practice, and we one of the things I think keeps our patients coming back, in addition to our awesome quality of care, is people get to know us. They get to know who we are. So that's why I like doing this type of stuff as kind of our outreach of, hey, like who is this guy that I'm going to go see. I always tell people that being in the healthcare system, or being a healthcare practitioner, is kind of always in my blood. My father is a medical doctor. My grandfather was a medical doctor, and so and then when I was going to school, I always was attracted to, and it just kind of came natural to me with the sciences, and so I wanted to follow in their footsteps. And when I got into school, and then also growing up, I kind of saw that my dad was very busy, and so he was on call. He was an OBGYN, and there were times when he would miss some of our games, our practices, and sports we had growing up. And it's my dad and I have a great relationship to this day. But at some point, I wanted to be able to try to marry the two worlds. So, hey, how can I provide for people and help people and be a healthcare provider, but also have the family life that I so desired? And that's where physical therapy kind of came in, and my eyes were open to it. And my eyes were open to it also in kind of the classical story, which a lot of PTs can have, which is I myself got hurt. I got hurt playing sports, a couple major knee surgeries, a couple ACL surgeries, a couple meniscus surgeries, and yeah. And but I wouldn't have gotten back to being where I am now without a fantastic physical therapist. And so I talked to her while on my second go around, and said, hey, what does it take to become a doctor of physical therapy? So yeah, so I went on, I got a master's degree in a different field, a related field, and then I applied to to my DPT program at the University of Florida. They let me in somehow. Just here I am to this day. So and I think that getting hurt, having something taken away from you, because I still think of myself as an athlete to this day. I still will compete in some recreational sports and some amateur kind of strongman type of competition. I still train like I'm a competitor with my own training, and I wouldn't be here without the physical therapy I have, without the knowledge that I have. And so, but there's a point where that was kind of taken away from me. It was, and so that empathy, being an empathetic person, is a big part of what we do. So people walk in my door, something's been taken away from them, their identity's been taken away from them, and we try to empower them and restore that identity.
I love that. One, super awesome to have great role models like the folks in your family to start this ball and getting it rolling, right? But I love the empathy piece of what you said. And I think people don't talk about that enough. You don't realize what you have until it's gone. And it's hard to maybe treat someone when it's like maybe you absolutely do love what you do, but maybe you haven't always been in their position and you had, and in multiple occasions, and what that's like to what it takes to get better, to continue being the athlete that you want to be, but also just get like the normal basics back too, like that it can also be taken for granted, just getting out of your house every day, doing, making yourself coffee, like whatever that might be.
Yeah.
I think that journey looks different for everyone, but that's really cool that you have been able to meet people with where they're at.
Yeah. I don't ever wish pain upon someone, but in particular my employees, right? But it's I do encourage people, to push themselves a little bit. And what I mean by that is, if you haven't, it's hard to empathize with someone if you haven't been in their shoes. If you haven't, especially, we are, we're known kind of as doctors who lift around here. So we work a lot with weightlifters and power lifters. We still see, our grandmas and grandpas who have back pain, but if it's hard if you don't know what it means to push yourself to that level. And pain is pain is part of the human experience. It is at some point in your life, everyone's going to have some level of pain. And so, again, I'm not trying to wish on people pain on people. I'm not trying to have people do something they're not comfortable with, but it's just part of being human. If you haven't experienced pain, we can't relate to each other as a species. And really, at the end of the day, yes, I have all these letters after my name, but it really comes down to talking to the person that we have in front of us and getting to know that person and what drives that person, what do they want to be able to do, and just establishing that connection. And I really, I feel like we accomplished that here in my business.
That's amazing. I love that. In terms of the people that you are seeing, you talked about some of the people that, you know, that are very active athletes. What do you find that people are commonly struggling with? Do you kind of see something day in and day out that's like, man, like, yeah, that is a very popular pain point, or maybe even there is some crazy stories that you've had where you're like, that was a unique problem. I'm really glad we got to the bottom of that.
Yeah, I mean, I know I don't know how long we have. You got 5 hours. I've been I've been practicing coming up on 13 years. So yeah, there are a bunch of stories. I mean, I could tell you about a gentleman who came to see me because he fractured both legs and injured his shoulder heliskiing, and he wanted to get back to heliskiing. We got him back to heliskiing, and I never thought I'd use the word heliskiing in conversation. Yet here we are. So yeah, that's an example of some outrageous people that we see, but we also see. Listen, honestly, my favorite stories, and kind of I'll answer your question is people who have been told for so long that they can't do something, or they're so fearful of doing something, that they have completely changed their identity, and they have limited their ability to spend time with their friends and family. So I mean, I can't tell you how many again, grandmas and grandpas that have come in here, and they were told back in 1987 that they should never bend over and pick something up because it's bad and their discs are going to slip out, or their deadlifts are horrible for them. Like, you should never do that. And so then they stop doing things like bending over to do the laundry. And if they can't bend over to load their laundry machine, well, guess what they're not going to do? They're not going to bend over and pick up and play with their grandchild. Right.
Mhm.
And so the stories that I like the most are those people who they come back and they say, thank you. I can play, I can babysit my grandkids, I can play with my grandkids, and my kids don't have to worry about it. They can go out and they can enjoy time for themselves. I can enjoy time with my grandkids. And those are the stories that I really like. Yeah,
I love.
yeah. One comes to mind, and I know I just told a couple, but one of I'm a father, and I have a couple kids. They're young still, and a young woman came in to me, and she had knee pain, several knee injuries, and she could still walk and move, but she was so afraid of what would happen if she did something wrong with her knee that she and her husband were contemplating not having children or pushing off having children altogether because she didn't want to have a newborn, trip, have her knee give out, and then injure her child. And she went through rehab with us, did a few months of that. About a year ago, on Instagram, she tagged us, and she had gave birth to her child. And she thanked us for being part of her journey. And that those are the stories that I like. I mean, not like, I love. That's and those are, it's every day. So it's one of those things that I really, that makes it all worthwhile.
That completely like gave me goosebumps for starters. That is very, very cool and very, very meaningful. I really appreciate you telling all these different kinds of stories because maybe some people have an idea about what physical therapy is or what that means to them. And um, these are incredible. Everything that you've done for these people, and having them go through daily life, and being pain free, or getting to that next stage of life is huge. So yeah, you should 100% feel really incredible about that. But in terms of, and you've kind of like, explained this already, and we can already definitely see how you approach people and how you're so different as a practitioner. But is there any other ways that you think your practice is different? Maybe do you use any kind of special modalities within your practice that have been really great and successful for your patients today?
Sure. Yeah. I want to. Well, thank you. I appreciate the compliment, and I do feel proud of the things we've accomplished. I don't and I don't feel that we've done anything special here. What I mean by that is it's more that we fostered an environment where the traditional PT model uh, is such one that people get run in, they get treated like cattle, and they get run out. Sometimes people respond to that, but more often than not, because pain is never 100% anatomical. There are always non-muscular factors with pain. I'm not a psychologist. I don't treat any of these things like anxiety, stress, and depression. But oftentimes, the biggest thing that our patients need is just someone to listen to them. And because we practice one-on-one in an environment, then that allows that anxiety, that stress, and depression maybe to start to just handle itself. If not, then we obviously refer out. But I don't. The tenets of physical therapy are, there's nothing new that's coming out that is going to be some sort of magical potion. We use certain things like dry needling. That could be a benefactor. People could benefit from that. That's something that has got some evidence behind it. We use certain hands-on techniques that's got some evidence behind it. And we foster a lot of progressive overload strength training because of all the evidence behind that. But at the end of the day, I think that the biggest thing is because we're one on one and our patients get to have the conversation with us, that a lot of their fear, their anxiety, their stress is diminished, and that to me the biggest breakthrough in terms of the success that we've had and the success that they encounter.
Yeah, for sure. And just finding out what other people are doing on a day-to-day basis might trigger something for you. You actually getting to know them and caring and taking an investment and, their recovery, might you might say, oh, like you're doing that. Like, yeah, that is probably contributing to, because, and just having conversation, you'll get all that information. So that is something, sometimes things are uncovered in interesting ways, you know?
Yep. Yeah. It's one of the questions that I try to ask at the first visit. I'll ask it periodically as well. Is hey, is because we'll go through a typical
Yeah.
objective. Like, tell me about your pain. What makes it worse? What makes it better? What are the things you want to do? Those are all important because that helps from a diagnostic standpoint. It helps from a plan of care standpoint. But the one of the questions that we always try to ask is, hey, has anything changed in your life in the last few months? And sometimes, more often than not, the answer is like, no, not really. Every once in a while, it's like, well, actually, like, I'm going through a divorce. My house is being foreclosed upon. I lost my mom. And so these are things like, well, here's what I know about these things. These things can lead to stress. These things can lead to a lot of anxiety, and we know that with higher levels of anxiety and stress, people's pain goes through the roof.
Yeah.
And so, again, I'm not treating anxiety and stress, but my job as a doctor of physical therapy is to bring awareness to it and talk to my patient about it and say, hey, like, this might be something that we want to look into, getting a handle on so that we can help over here on the physical, and then we can achieve your goals.
Yeah. I really like your holistic approach in that. It's not just concentrating on the symptom, but it's looking at the entire, person and seeing what's going on with them. But something kind of segueing into something that I absolutely love to talk about. I've been talking about this for the past 5 years, and every time I get a new answer, and it's so exciting. So I'm very excited. I know. I'm very excited to hear your perspective on this. So,
Okay.
what are some of the misconceptions about what you do, your business? There's a ton in healthcare in general.
Yeah.
That's why there has been so many different answers. I've heard some crazy ones coming on this interview, but would love to hear what do you feel like you're debunking on a day to day basis? Like what?
Oh,
Yeah,
yeah. I feel like I am about to try to go through, like that one of the. It's been a few years since this meme has been out there, but it's like, this is what I do on a daily basis. This is what my parents think I do on a daily basis.
yes,
Yeah. All right. So I'm gonna like go through all of that, I guess. Uh, so I'll kind of start from the top. People think that physical therapy is supposed to hurt. No, it's not supposed to hurt. So it's pain does not mean that tissue damage is happening. The analogy that we like to use is that pain is like a smoke alarm. What I mean by that is that the smoke alarm goes off in your house. It doesn't tell you where the fire is. Doesn't tell you how bad the fire is. Sometimes there's not even a fire at all because the smoke alarm is faulty, right? So, but on the off chance that something's going on, I don't want to ignore it. I want to investigate, right? So, so basically, like, no pain, no gain over here. We don't like that. Everything's got to be pain free over here. That's probably not the best way to live life either. So we're kind of somewhere in the middle. So that's the first probably misconception that we deal with, that things have to be pain free or that we're going to make you hurt. No, we're not going to do that. The other misconception that's pretty classic is that we're just massage therapists in disguise, or we're just personal trainers in disguise. So meaning like sometimes people go to physical therapy and all it is just hands-on soft tissue work. Sometimes people can respond to that, but we feel like there's more to it. On the other hand, sometimes people go to physical therapy and all it is just exercise, exercise, exercise. Great. Well, most people respond to that too, but a lot of times that's not the end of it. Or people can't tolerate massage or people can't tolerate exercise without certain caveats. So we kind of marry the two worlds. These things right here, yeah, they help people help make people feel better. But really, at the end of the day, it's also what's going on up here, which is how can I talk to someone, educate them about their pain, and progressively make them stronger, more mobile, more balanced, more controlled. So those are kind of the pretty classic misconceptions about what physical therapy is. That it's gotta hurt. That all we do is massage, or all we do is exercise. So it's always kind of a multifaceted
yeah,
approach. Yeah.
it's crazy. It, yeah, there's literally so many, and I'm sure like in Google, ChatGPT, maybe
What
sometimes
what is
helpful.
physical therapy?
Yeah. Like
Yeah.
maybe sometimes helpful to a point, but you can't believe everything that you read and see online. And what,
What?
yeah. And
Yeah.
really? And so, I'm sure you get a lot of like, well, I read this online, or I was in this forum and I was on Reddit and I read
Hmm.
this true.
Yeah.
Um, I'm sure that's probably hard on because everyone's and their situations are completely different. And so that must be hard to kind of navigate that. Like in a
Yeah.
way, oh, you're not wrong, but in your situation, this isn't like the best.
Right. There's like one of the two things. One, our my profession is there's a little blend of art and science, and there's never, not never, hardly ever is there a black and white, or there black and white answers. There's always some gray. It's always what the classic answer from any physical therapist is. It depends, because everyone is different. Now we have evidence that shows that, hey, the majority of people respond to this, so the majority of people respond to that, and so that's a great place for us to start. But then we have to individualize it for the person we have in front of us. I mean, I can, in terms of specific things, like I can kind of rattle them off. That, like, your knees shouldn't go past your toes when you squat. That deep squats are bad or dangerous for the knees or for the spine. That deadlifts are bad for the back, right? That, throwing is dangerous to your shoulder. That lifting overhead is dangerous to your shoulder. That that if you should that just because you have pain, or just because you have something on imaging, that you should, automatically get a major surgery to correct it, just because of what we find on imaging. And then I could go through a whole list of diagnoses. Rotator cuff tears, like the rotator cuff tears are so common in like 60 and 70-year olds, that you basically might as well say that a rotator cuff tear is normal in that age range. Disc degeneration, disc herniation is so common in people who are like 50 and above, that you might as well say it's part of being normal is to have some sort of disc issue. And these are in people who don't have pain. So what I tell people is that, listen, I respect what we have on the MRI, especially if they have pain. But
Yeah.
then I have the conversation of, here's what I also know about your diagnosis. That 60% of 60-year-olds with full thickness rotator cuff tears do not have pain, right? Or that 50% of 40-year-olds, hey, I'm 42, 50% of 40-year-olds have disc degeneration on imaging with no pain. So you could flip a coin, take an MRI of my back, and there's a 50% chance that I have disc degeneration. I don't have any back pain. So what does that mean? Well, that means that something else is going on, that I'm not ignoring the anatomy or the anatomical abnormality, but we have to investigate in a whole bunch of other things.
Yeah.
And it could be from the physical to the non-physical.
It's a really good point you bring. Like, yeah, everyone looks so different. You could have the same thing going on, and one person could be experiencing a load of pain, and the other person none at all. So it's a really good thing to keep in mind. And one thing, kind of what I like to end things with, is kind of a fun two-pronged question. Uh, I'm just full of surprises, I know,
I
but
know.
we're very fun over here. Um, just because you have a really interesting background, you have really built up your practice. Two two kind of pronged ways of giving advice. One, what is advice that you would maybe typically give to a client or to anyone that is like in pain, maybe not in pain, or should consider physical therapy? Some advice there, but also to maybe folks that are in private practice. We love the private practice community. We're big in sharing. We want to bolster this community up and see them thrive. What are some pro tips that you might give to other practitioners, other practice owners, that are something that you hold near and dear to your heart, things that have made you successful or you feel like everyone should be doing in their practice today?
Yeah, yeah. Oh, all right. I thought you were going to ask me something else. But no, uh, I'll answer the second question first, because
Yeah,
that's a little more kind of cut and dry, and well, in terms of what's worked for me. So for doing stuff like this, when you reached out, I was very excited, to do it, and so this just gives us another opportunity to basically let our story be known, and to let people get to know us. And I think, especially in healthcare where there's a lot of mistrust with your practitioner or the practitioners out there that doing things like this, especially in your private practice, so that people can get to know you. That goes a long way, especially in what we do, where there is a lot of buy-in. I won't quite call it placebo, but there is a lot of buy-in. Like if they can trust me, they can trust any of my other doctors, that goes a long way in terms of the confidence they'll have and that we are doing the right thing. I mean, the evidence we do it, we practice evidence-based practice, so I feel like we're doing the right thing anyway. But the second part of that is the patient needs to buy into it. And so doing things like this, going out into the community, getting to know people out in the community, helping your community as much as you can, and networking. I mean, it's networking is one of those things that we're not taught how to do in school, and so but networking at the end of the day is just getting to know people, just having conversations. So that those would be my two biggest pieces of advice. Is if you are a struggling practitioner, private practice, you gotta get out there, and if you're an introvert, you got to kind of make yourself an extrovert. Not all the time, but if people don't get to know you, they're not going to walk in your door. So that's
That
really my.
is fabulous. That is an amazing piece of advice. People should not undervalue their community and really get out there. And you're right. Like if people aren't seeing you, hearing you, they're not going to you. And if you're not making those connections, so super important. Yeah, I think I get it. Everything's digital these days, and email is and texting is so convenient, but relationships still are everything. And I feel like still really run the world in a way. We still all need community. So I thank you for saying that. That's amazing.
Yeah, I mean we are still human at the end of the day. We're
Yeah.
human. We're social species, and so we crave that. So yeah, no. And in terms of the first question, which is, I guess I'll kind of answer it this way: when do you need physical therapy? When do you need someone like me? I mean, the classic answer is, "Or you got hurt, you can't do the thing that you want to do. You find out what's going on and feel better. All right, yeah, that's the time to kind of come in. Not to kind of that's the time to come in. So that's the kind of classic one is like, hey, I can't work out like I used to, or I can't work out at all because I hurt my shoulder, I hurt my back, I hurt my knee. So as a doctor of physical therapy, my training, my education allows me to diagnose and treat any and all musculoskeletal conditions. Probably more importantly, I'm taught when things are not musculoskeletal and that when people are not appropriate to be in my clinic. Fortunately, that's few and far between when that happens. But that's so people can kind of view us as your entry level into the healthcare system because and we're not anti surgery here. We're anti premature surgery, and there's so many conditions. I just listed a bunch of them that happen in the asymptomatic population that we don't necessarily need to rush to surgery with that. Oftentimes, these conditions respond to physical therapy. So the people that we like to work with, you people, we do like to work out with people. We do like to work with people who want to work out, want to train, and who can't. Whether they're competitive, they're professional athletes. Whether they're just your weekend warriors, your mom and your dad, or your parents who want to be able to play with their kids, and all of a sudden the shoulder hurts and they can't play catch anymore. Those are the people that we want to see because coming back to what talked about at the top, quality of life, enjoying your life, enjoying your time with your loved ones. You're not able to do that type of stuff, then that's the time to come to see us.
I love it. And speaking of coming to see you, I would love to wrap everything up today. And thank you, Dr. Hayes, so much for being here. I would love if you could tell everyone where they can find you, how they can contact your practice, and maybe ask some questions. Maybe there's some other practitioners was like, let's network, let's do it now. So I would love to hear more.
Sure. Yeah. So my business is Premier Physical Therapy and Sports Performance, and we're located. We have two offices. Our main office is in Clearwater, Florida, and we have a satellite office in Palm Harbor, Florida. So if those of you new to the area, that's basically west of Tampa. So on the good side, closer to the beach. So our website, you can find us on online. PTandSportsTherapy.com is our website, and our social media. If you just Premier Physical Therapy, Sports Performance on Facebook, and our Instagram is Run Tampa Bay. Run Tampa Bay.
Cool.
Yeah,
Awesome. Well, Dr. Hayes, thank you so much. And we hope to have you on again.
I'd love to be back.
Cool. Thanks so much.